Good afternoon, good morning in the United States. It's such a pleasure to welcome Dr. Dana Crawford, who's a pediatric and clinical psychologist with deep experience in trauma recovery and culturally grounded care. She has treated patients in all over the United States. And in her Manhattan-based private practice, she specializes in anxiety, chronic pain, racial trauma, and life stressors. She has developed the Crawford bias reduction theory training, a proven method to reduce bias, prejudice, and racism in clinical and organizational settings. Dr. Crawford holds degrees in counseling, African American Studies, Psychology, and the Arts from Howard, Temple, and Miami universities, along with certifications in nursing, medical hypnosis, and biofeedback. And she's the author of Healing Bias, Your Guide to Individual, Interpersonal, and Institutional Change. So let us welcome Dr. Dana Crawford. Welcome,
Oh, thank you
Dana.
so much. Thank you. It is an honor and a privilege to even have space to talk about this very important topic. So thank you everyone for listening, and thank you for having me and creating this space.
You're so welcome. Can you tell us a bit about your background and what inspired you to write Healing Bias?
Whew, big question. So, a bit of my background, I think from a young age, I had always identified as a healer, as someone who wanted to help people. And I think that seed was really implanted from my grandfather. He was a big, beautiful black man in the South, South in America, not South America, but really Jim Crow, anti-black. He was multiracial, American Indian, black man, and Irish. And he was, I don't know, maybe 8 feet tall in my little mind. And his voice boomed. When I walked, I felt like I could feel the floor vibrate.
Wow.
And he told me at a really young age the story of a friend that had hurt himself, and he had helped this friend and actually stitched him up. And he was maybe 14 years old and got some house thread and stitched this friend up. The next day, the friend's not at school, and he's worried, like, oh, did I do something wrong? He gets a call from the front office saying, you need to go to town. He's really nervous. He's a black man going to see the white doctor in town. He walks. My grandfather was a big storyteller, so he said, he had size 14 feet. He had to walk 200 miles in boxes, right? He didn't have shoes, the whole nine, and he somehow did that before the end of the day, and he got to the doctor, and he described that this white man looked at him and said, did you do this? Did you do these stitches to your friend? And he said, he called me Dana Morena. And he said, Dana Morena, I looked that white man in the face and I said, yes, I did that. And he said he was so scared, his heart was thundering. And this is a time where a black man, even a black boy, could have been lynched for a lot less. And
Wow.
so it wasn't a small thing to be a black boy to say, yes, I've done this thing that you've called me for, and I don't know what could happen. So he said, yes, I did. The doctor, very serious, looked at him and said, these are the best stitches I've ever seen in my life. This is amazing. You should go to medical school and become a doctor. Let me adopt you. I will adopt you and I'll make sure you become a doctor. And my grandfather said, no, I have to take care of my family. I have a mother and siblings. And so he did not become a doctor. He actually went off to war and fought in Germany as a black man and was exposed to many different things that led to many different layers of trauma. Your
Mm.
question was my background. My background is my people. My background is my family, is my history, is my epigenetics, the ways
It's a
in which my
beautiful
DNA
story,
was
Dana.
shaped.
Mm.
And so when I was young, as long as I could remember, my grandfather said, and because I didn't become a doctor, you will be a doctor. And so from a very young age, the question wasn't if I was going to be a doctor, it was what kind. And I grappled over the years. I thought I would be a medical doctor, go to medical school, and the plan, because I was the first person in in my family to go to college, my plan was to get into nursing first and really get a foundation so I could pay for college. So I went to high school for 2 years. And then I was in this program for kids that were at risk. I don't know what I was at risk for, just being poor, honestly. And I went to nursing school the last 2 years of high school, and I became a nurse. I started nursing school when I was around 14 years old, and I became a nurse when I was 17 before I could even vote. And as I worked as a nurse, I realized that a lot of the physicians, if not all of them, did not have time to talk to their patients. They didn't have much time with them. And I worked in a nursing home. I would have 46 patients. And I noticed that they asked for less pain medication when I had time to talk with them.
Wow.
When I didn't have time and it was a rush shift, then they would stay on that call bill. And I became really fascinated with the talking cure. What was it about these words that shifted their needs for medication? And I said, well, I'm not so interested in medical school. I want to go and find out more about these words. And I changed my major to psychology.
Wow.
And as I studied psychology and I looked through those intro to psychology books, many of the psychologists they talked about were white men. And I didn't see myself. I didn't see my grandfather. I didn't see my community in the psychology that I saw helping the patients that I was working with. And so I double majored in African American studies, and a long story, a little bit shorter. It took me down this road of exploring the intersection of medicine, psychology, and bias.
Psychology, medicine, and bias. So, what was the magnet towards healing bias? Because everything else makes a lot of sense. And you said very beautiful things like, I don't know what I was a risk for other than being poor, but it seems that you had a beautiful childhood, and and that's great. But there's an awareness of the rational bias. What was your intention when you decided to go this specialize in bias?
You know, it's interesting. I don't think any point in my career was a planned uh step. It was very much a curiosity. I noticed a problem and I wanted to fix it. I thought I could fix things, right? When you're young in your career, you think you fix instead of a companion in the journey of healing and helping, right? When I was just a
We all
baby
go
there.
through that.
Right, you think you're going to do something in a certain way. But often, as I started to explore psychology, I was initially very focused on trauma. I would notice things that my professors would say that were sexist, that were fat phobic, that were xenophobic, that very well-intentioned, highly educated, kind-hearted, lovely people were saturated with racism. And it wasn't just racism, it was the intersectionality of racism with classism. Or there's someone in my class with an accent and they speak down to that person, right? And so these little micro things, their bias. And that's when I became interested in bias as a whole and not just racism, not just sexism, not just nationalism, but more so how the brain categorizes and then shrinks one's world based on those categories. And so
Really
my goal in
beautiful.
healing bias is really, yeah, it's really to create a tool, regardless of the specific type of bias one has, but a tool to be able to examine and heal that humanitarian crisis that separates us, which is our biases.
That's so powerful, Dana. I'm very touched. Humanitarian crisis that divides us. That's so overwhelming and pervasive as I see it in the news and in society, in families as well,
Mhm.
and all over the place. I'm very interested in knowing more about how you developed this tool, how did it came about, and what were your findings on the brain shrinking from into bias? How did you come to that?
So it really started with an oldie but goodie in the field of psychology, some good old-fashioned countertransference, right? So if we take back to Freud and this idea that a patient comes into therapy, a client comes into therapy, and they transfer their unresolved intrapsychic wounds onto the therapist. And the therapist is supposed to be a tabula rasa, a blank slate. And of course, we're not blank slates, right? We are all living
That does not
beings,
work.
despite our best efforts, right? Right? And so, because we are not that tabula rasa, blank slate, we then, for that client's transference, have countertransference. And so, I was really interested in how does this countertransference show up in the therapeutic relationship, not the transference, because a lot of the research when I was in graduate school focused so much on the client's transference, the client's experience, understanding the clients, and the American Psychological Association's recommendation around cultural competency was very client oriented and not looking at the actual tool in therapy, which is the therapist. And so, in moving from countertransference, it's a very abstract term, right? Like, what do you do with that? And as a profession, if I walk into a room of psychologists, half of them are going to hate the term countertransference just to begin with. And now we're in an argument before I even got past my first slide. And so to move away from that and to make the work more accessible, I moved away from countertransference and then culture-based countertransference, still way too abstract. As the model advanced and I moved from working with therapists into hospital settings, physicians would say, well, therapists aren't the only ones with countertransference. We have countertransference too. And the nurses would say, well, this is an issue too. That nurse just did this thing. And then nursing assistants and then front desk and even sanitation and environmental services. And so then I said, this is more of a human phenomenon. And we shifted to bias. And I realize that, if we're really understanding bias as shortcuts, as often bias isn't always hate, it's often habit. And something about that becomes really critical to understand because, in truth, bias is a socially transmitted disease in which we're all infected with. And so the model became bias reduction. And to honor my grandfather, his last name and mine, Crawford, Crawford bias reduction theory. But I wasn't okay with just sitting around writing beautiful books, which I hope this book is beautiful and wonderful. But I
It
also
is
wanted it to have a training component and have a relationship that theory is informing practice and practice is informing theory. And it is very much relational and responsive to the quick ways in which bias shifts. We can have a bias at one point and then a civil war happens. And now we have a new type of bias. In the US, we went from 9/11 that had some level of Islamophobia, but my goodness, after 9/11, the level of Islamophobia. So bias is very responsive to the social moments. So the goal of the theory is to, yes, be anchored in the science and also be responsive to the society.
beautiful, beautiful. And how do you go about the premises of your theory? How do they translate into a training? What do you do with, how do you train groups, right? In companies, social institutions, clinicians?
Yeah, so I've given trainings as short as 10 minutes and as long as every day for 8 hours for a week. And no matter how long the training, people will always say, I wish it was longer. And it's funny, I met with one group once a month for 2 hours for 2 years, and they said, oh, it should be longer. And I'm like, my goodness. But it really speaks to people's desire to engage in this work. The first part is really taking away the judgment, the moral issue that this isn't about being a good or a bad person. What does that even mean? And to remove the shame and the guilt and to stand in the space of our shared humanity and how that shows up with bias. And so I start the trainings with just creating a space where people can let their guard down. We immediately do mindfulness so people are present. So often people are participating in presenteeism where they're physically there, but their mind, their spirit, their cognitions are not. We then move into understanding bias and awareness, and how it shows up. How does it get triggered, and how do you cope when that bias, prejudice, and racism shows up? Then we investigate how does it show up and manifest individually inside of me, interpersonally between us, and institutionally around us in our surroundings and our systems. And lastly, how do we reduce it? Reduce it not in a reactionary way, I saw this thing and now I want to get out and protest or boycott, but in a strategic way. How do I think and explore how it's showing up, not in a code switching, I want to be a good person, lying to myself, I would never, I could never, but in an authentic way. Being mindful, which is a critical element of our bias reduction work, you have to be aware. And all of those factors lead to strategic and sustainable action. So, in the training, what we're building out are four core things to stop reacting when you are activated by someone else's culture or by your own. To stop reacting, do not react to that. Slow down, breathing, mindfulness. We're doing this in the training. Assess, what is this activation about? This person has an accent. This person is from this country. This person's skin is this color. What is it about this that makes me feel, that makes me think, that makes my body respond? What is that? Probably related to some unresolved psychic wound, maybe in my childhood, or some video think a certain way. And then recall, what skills do I have to manage this or learn new skills?
Okay, okay. That's amazing, Dana. Let me tell you, that's really amazing. Could you tell for the public what are the benefits you get from reducing the bias of your own,
Mhm.
an individual? What are, or society, societally, what does that aim to?
Well, the biggest thing is that because bias does shrink our world and makes us think in very limited ways, the biggest benefit is that it expands our world. It gives us access to more resources. And the truth is, diversity is beautiful and it's wonderful and it makes life great, just on an enjoyment level, but actually, diversity enhances our efficiency. And understanding and having diverse thought, we can actually improve our systems. And so, one of the biggest parts of bias is that it makes our world more efficient. So, think about specifically like a disability. One of my favorite outcomes of inclusion is the curb cut. So the curb cut is when you are on a sidewalk and there's a part of the curb that is cut. And now you can use your stroller, not just your wheelchair. That was created specifically because people were saying, hey, let's think about people who use wheelchairs. Now, people who use wheelchairs, who use crutches, who just are moving things and delivering your Amazon packages can use that curb cut. So, when we are aware of our biases, it improves the world for everyone. It didn't just improve the world for those who are using wheelchairs.
It makes sense. Makes sense. So it's a way of creating, is this, how is it connected to some activism that's necessary for a change?
Yeah, bias, being aware of your bias is really crucial because if we think about activism, people don't even know what to advocate for. If you don't have an awareness of your biases, if you're not aware of the impact of not having access to the curb, how can you advocate? And so, ableist language would say a blind spot. Um, I would say an area of your life you're just not aware of. And so you can be completely, I think about staying in a hotel. So I'm a Black woman, and my hair texture is different from people who are not Black. When I stay in a hotel, they have a shampoo and a conditioner. If I was to use the standard shampoo and conditioner in a hotel, my hair would fall out of my scalp. It
Wow.
it's terrible for my hair. It would strip all of the oils, it would break off, it would be terrible. Now, this is not an area that most people who do not have Black hair would even consider. But if I'm in a room with 1,000 people and there are 200 Black people, and I say, raise your hand if you don't use the shampoo and the conditioner in the hotel. Probably 199 Black people would raise their hand and say, absolutely not, I would never use it. It's not made for me. Now, advocacy would require people to be aware of this. Now, I pay the same money for a hotel room as you do. Why would I not be able to use all of the products that I paid for? And so, being aware of our biases, the very bias that everybody has hair, so obviously everyone uses the same thing. That's not true. And so, by spending time understanding, listening, talking, reflecting, then we create a world that is more inclusive. And then eventually, maybe we have multiple shampoo products in that hotel room. Now we have some contracts that are more international. Now you've built business. Financially, it's a lot more profitable. Maybe I can even select it before I come. And now we have customized care. And now your business is now considered culturally sensitive. Right now, look at the abundance that can come from that. So even on a practical level, just that alone could change the experience and the efficiency of an entire company.
Yes, I so appreciate this. So, in this moment of history and deep divide in the states and all over the world, or like we're polarized into extremes, and people believe they are safer in their little silo. This can be a very holistic remedy for fear and for advancing projects and for keeping the world diverse. With this, we had a surge of diversity and inclusion programs all over the world, and now this extreme want to cut them out.
Yes.
How could healing bias address this situation?
hmm it's so interesting you share that because I think how wonderful it was that we had this increase in diversity, equity, and inclusion, and so many people were joining this work. Unfortunately, many of the people who were doing that work were not informed of psychology. There weren't
Okay.
psychologists. Oftentimes you could have been an architect and had some marginalized identity. Perhaps you are an architect and you're gay. So now you're the head of the Architects of Society DEI program, right? You didn't have any training in group processes and group learning on talking about tender conversations. You had a lived experience, which of course is critical and needs to be honored, but group dynamics. And as psychologists, we are very aware of the power of fear in creating divisiveness. So, in 2022, I started talking about my concerns of the anti-DEI movement. And it specifically had to do with, I would hear stories in my workshops where people would say, I wasn't going to come to your training, but I heard great things. But in my last training, someone said this to me, and it was so off-putting. I went home and I cried. I felt traumatized. And I kept hearing people talking about being traumatized by their DEI cultural trainings that were led by people who did not know how to manage and engage with trauma, cultural trauma, race trauma, gender trauma, regional trauma, and so forth. And
Beautiful.
so as I started to see that, the response to that trauma in our legislation in the states started to be what's called epistemicide. Epistemicide is the study of how knowledge is killed. And so we started to see banned books, banned words, banned concepts, and they started with critical race theory and the book 1619. And so this spread of epistemicide that was a response to the trauma of engaging in this bias reduction work. And
Okay.
so what's very different about healing bias is that it includes the trauma science in healing the bias. And you cannot talk about and engage with, you can have all the history in the world, but if you don't talk about the trauma of the history, you're going to get a backlash. And that often looks like epistemicide,
Mm.
genocide, and retrenchment, which is what we're seeing now. Retrenchment is the rolling back of progress made in equity and inclusion. And we've seen many cycles of retrenchment from the ending of enslavement to Jim Crow to civil rights to where we are right now.
I
And so,
get it.
what's very different about the book is that it goes to the core of why these biases are being perpetuated, which is
Yes.
the fear and the scarcity mindset.
Okay. Thank you so much. It makes so much sense. That is amazing, Dr. Dana. I'm so happy to have had this interview with you. And before we close, I wanted to invite you, if you would like to share what has surprised you the most in your journey in working on bias and healing, and how has your perspective evolved after writing the book?
Yeah, this book, I wrote it over a lifetime. They say your first book, it takes you a lifetime to write it, and then after that, you know how to write a book. But there is something specifically painful about having a book called Healing Bias when there is an anti-DEI, anti these conversations space, when we are in the era of epistemicide, of literally deciding these words should not be said in the workplace. And I wish that I could have had this book come out a month after the White House banned language, where I could talk about the pain of epistemicide, the fear. When this book came out, it came out a few months after this issue of not that racism, that DEI was divisive, was illegal and immoral, where I had always thought this was love work. It was the work of making a space for each other. It is the work of becoming a better human to yourself, to each other, to the next generation. And I was so afraid that the government would come to my house and lock me up for writing these words.
Wow.
Um, and the ways in which people I had relationships with for years, mentors that supported this work, that then didn't want to write a book review, that wanted to dissociate themselves. I had one colleague had done some consulting work with and had to send her some tax documents. And she said, I'll pay you back all the money. I just can't have your name associated with my taxes. And I didn't expect to go to bed in one world and wake up in another.
Amazing. That's so.
And it has been a very painful year, surprising in some ways for people who stood firm in the work, and utterly heartbreaking for people who believe a thing but are too afraid that they will lose their job, that they will be targeted. I have mentees whose children's school addresses were posted on a website, their personal addresses, right? The very real fear. And I hold that where I am responsive to the moment, but also aiming to hold integrity to the work and the science. And so, how does one market a book in a world that's anti that topic? I think for me, it's been a lot of prayer and connecting with colleagues and trusting in the love of liberation for all people.
Yeah.
Thank you so, so much. That is very changing, and it touches my heart to hear you. And at the same time, I feel there is a lot of light in what you're saying amid the darkness of the moment.
Mhm.
So I'm gonna keep in touch, and I'm gonna ask everybody who watches this recording, we're gonna hope have Dr. Dana with us teach about her work with epistemicide and on all healing bias and how bias really hurts human beings and shrinks your world and make you small and divisive. So I really welcome, if you are listening and you feel touched, please follow or list so you can receive the news about the upcoming workshop. Thank you so, so much.